Did you know that mild hearing loss can impact your brain health? Today, we'll explore a truly groundbreaking research study on how healthy hearing may help preserve your cognitive health and reverse negative brain changes. This is important for anyone who has even a slight degree of hearing loss. I know many people with tinnitus, for example, have a tinnitus problem. They go to the doctor, they get a test. The test shows they have some hearing loss. So, the question we'll explore here is, does that hearing loss by itself impact our brain? And if we want to stay healthy with our cognition and our brain function over years, then should we do anything about this hearing loss? Brain imaging has found that people with hearing loss have changes in their auditory visual brain, even with a mild hearing loss. And look on the screen right here. We'll be reviewing some of the results from these imaging studies that are truly fascinating. We're going to tell you what you need to know and what to do about it. I'm Dr. Ben Thompson, joined by Dr. Suzanne May. We're audiologists at Treble Health. We specialize in tinnitus and hearing loss. First, let's jump into this important factor of cognitive decline, dementia, and healthy aging. What we know is there's more and more research finding that to prevent things like dementia, Alzheimer's, negative brain changes, there's things we can do. And we call these modifiable risk factors. So there's actually things that I can do every day that will give me a better chance to have a healthy brain later in life. And no matter how old you are, you can do things that can change or modify your risk of these negative brain changes. Interestingly, research found that hearing loss is one of the top modifiable risk factors for cognitive decline. And that's according to studies like the Lancet Commission on Dementia Prevention. So, why does this happen? Well, if you have untreated hearing loss, it leads to what's called auditory deprivation, meaning your auditory brain has a lack of input. It's not getting the same amount of stimulus as it once did. And that causes changes in the brain structure and function. Every action has a reaction. So a lack of input into the auditory brain would have a reaction for the brain changing and modifying accordingly. Your brain, your cognition, your ability to function mentally, it needs resources. And sometimes those resources are diverted to processing degraded auditory input, leaving fewer resources for your memory, your concentration, your attention, and your executive function. Today's article that we'll highlight is Dr. Glick and Dr. Sharma, who created this article that was published in 2020 in the Frontiers of Neuroscience, that looked at the neuroplasticity in our cognition and how that is related to mild to moderate levels of hearing loss. Also investigating what is the neurocognitive benefit from hearing aid use. In this image, you can see that individuals with age-related hearing loss exhibited significantly lower scores in these important cognition measures like global cognition, executive function, processing speed, visual working memory, and auditory working memory compared to those with normal hearing. So the question is, which we'll explore, what happens when we treat the hearing loss? Does the brain adapt and modify based on a treatment? The researchers from the article said that hearing loss increases cognitive load, depleting spare capacity for other tasks like memory.
So, this article discusses the science of cortical neuroplasticity and hearing loss. So, what is neuroplasticity? Well, that's the brain's ability to adapt and reorganize itself in response to sensory input or deprivation. In hearing loss, this often results in a shift where auditory processing regions are recruited for non auditory tasks. Dr. Sharma explains this reorganization is where regions of the brain normally used for hearing are repurposed for vision or touch. So, some key findings in Dr. Sharma's research show that with an EEG, there was cortical reorganization in patients with mild to moderate hearing loss. Let's take a look at this image and how hearing loss affects the brain. This EEG map illustrates cortical changes in people with normal hearing compared to those with untreated hearing loss. For example, in the normal hearing column, you can see that auditory processing regions are active where they should be. In contrast, the hearing loss column shows a dramatic shift in brain's activity with auditory regions being taken over by visual processing. This shift is known as cross-modal reorganization, and it highlights how the brain compensates for the lack of auditory input. A quote from the hearing review, it says, auditory deprivation leads to an increase in visual and somatosensory activity in the auditory cortex and can slow down the cognitive decline. The reintroduction of sound through hearing aids or cochlear implants appears to reverse some of these changes, demonstrating the brain's remarkable capacity for neuroplasticity. After 6 months of hearing aid use, the auditory cortex returned to more typical functioning and cognitive and speech perception improved. There was some importance of early intervention. Dr. Sharma emphasized that the earlier we intervene with hearing aids, the better the outcomes for maintaining our cognitive function. And the research published found that even mild hearing loss can accelerate cognitive decline if untreated, while hearing aids slow this process by restoring auditory input to the brain. So, restoring sound through hearing aids helps reverse these changes, highlighting the brain's remarkable neuroplasticity. Quote, hearing aids are not only going to restore sounds, they promote typical brain reorganization and protect cognitive health.
Earlier this year, I went to a conference in San Francisco, and Dr. Sharma presented on her neuroscience research. And it was amazing because the data showed very clearly that people with hearing loss have changes in their auditory visual brain, even with a mild hearing loss. And we can reverse those changes, which seems to have a positive effect on cognition and potentially modifying or reducing the risk of things like dementia and negative brain changes. So it's really shifting the conversation around treating hearing loss to now keeping and preserving my healthy brain function. And you might ask, well, what about tinnitus? What about ringing in the ears? Because I have tinnitus. I don't have that much of a hearing loss, but I have a tinnitus problem. Even if you have any degree of hearing loss that could benefit from hearing treatment, the research shows that even a mild hearing loss going through a treatment will show on the other side that the brain is in a healthier state where the auditory parts of the brain are more focused on sound and the brain's not taking away some of those valuable unused resources and putting them into other sensory areas inside of the brain of the cortex. So, what is the connection between tinnitus and hearing loss? Well, tinnitus is often a symptom of hearing loss, and it shares similar mechanisms of the neural hyperactivity and the auditory cortex reorganization. Addressing hearing loss with hearing aids may reduce tinnitus severity by restoring some of that auditory input. And we certainly see that with our patients at Treble Health. Simply having hearing aids for someone who has a high pitched hearing loss, that can take the edge off of the tinnitus. For them, they might say, yeah, when I have the hearing aids in, it automatically brings the tinnitus down a bit, providing some relief. So, on top of that, we know that tinnitus impacts hearing, hearing impacts the brain. So, there's obviously some relationship here. Research is still figuring out what exactly this means. If you have tinnitus, does that mean you have a higher risk of cognitive decline? At this point, I haven't seen any research that suggests that. So, even though there are some, in my opinion, false advertisements that are on the internet right now, where they're intentionally trying to scare you about tinnitus means that you have negative, brain changes. That's not true from the research that I've seen. That's not what it shows. Of course, we're following it and we'll keep everyone here updated with any updates. But I would say that's good news so far and don't be too scared about that. So, what are the benefits for hearing aids for tinnitus and cognitive function? Well, hearing aids reduce the brain's cognitive load, freeing up resources for other tasks. And think about this, if you're at a dinner party or a restaurant and you're trying to hear someone and it's hard, you have to strain. Everyone can put themselves in that position of almost squinting your eyes, having a tight forehead, and trying to listen in, maybe like actually physically leaning in towards that person, maybe putting your hand next to your ear because you want to hear them. That's taking up mental energy, essentially, stress on your brain. We have a limited cognitive load, how much information we can process at a time, depending on how challenging it is. So keep that in mind that hearing aids can actually help with that function of it. Now, this graph from the study shows the baseline group differences in speech perception in noise. Individuals with hearing loss showed significantly worse speech perception in noise, background noise, compared to those with normal hearing. All right, no surprise there. That makes sense. And we know that patients with tinnitus often report relief with things like sound therapy and hearing aids. So you could see how that provides simultaneously some cognitive benefits if you're less affected by this intrusive sound. You could see how that would have positive impact on your brain health. And now these graphs here on the screen, they show the effects of treatment with hearing aids on cognitive function in age-related hearing loss across 6 months of hearing aid use. The data demonstrate a positive association with consistent hearing aid use and how that leads to cognitive improvements in these key important areas like working memory, executive function, processing speed, and your global cognitive function. So, Dr. Suzanne, you are seeing many tinnitus patients working at Treble Health. We have a team of audiologists that specialize in tinnitus and hearing. Who should be concerned about this research? If someone has tinnitus and they have a mild or moderate high pitch hearing loss, should they be worried? What should they do?
I think anyone with mild to moderate hearing loss should get, if they haven't had a hearing test, they should get a hearing test. And they really should strongly consider getting treated, knowing that the results on this research show that hearing aids can help even with a mild hearing loss and those mild cognitive changes that are occurring. So I would say anyone with that degree of hearing loss should get go ahead and start the treatment process.
I would agree. And this research makes it very clear that treating hearing loss is not just only for your hearing, but it's also a important part of your healthy aging and keeping the best cognitive function that you have.
And a lot of this research study showed that early intervention can help preserve the brain structure and function. And Dr. Sharman noted that hearing aids are not just for hearing, but they're a tool for maintaining overall brain health. In this image, it shows that there is an incredible reversal of brain changes after 6 months of hearing aid use. Notice how the auditory cortex resumes close to normal function, demonstrating the brain's remarkable adaptability. There are real world benefits of hearing aids, including better hearing in everyday situations, higher satisfaction with everyday life, and reduced social isolation. And if you look at this one more study, this one more image here, hearing aids don't just improve sound, they enhance cognitive performance. So the graphs show improvements in memory, processing speed, and executive functioning after 6 months of consistent use. So I would say that's a good reason to go ahead and treat your hearing loss if you have some.
Neuroplasticity can reshape your brain with hearing aid treatment. That's a positive thing, and we're glad that's an option. We want to be able to change something that's gone bad. So that's a really good sign. And also knowing that when you treat your hearing effectively, you can hear people much more easily in background noise like restaurants, a dinner party, a group setting, driving in a car where there's background noise, all these important situations that we know we do want to hear the people we love. So, hearing loss is more than just a challenge with sound. Left untreated, it can reshape your brain in ways that may accelerate cognitive decline. So, the good news here is that hearing treatment, like hearing aids, if you have tinnitus, you should consider, if you have tinnitus and hearing loss, to use hearing aids as part of your treatment. That's what we see the most success with our patients. When hearing aids are used as a part of a comprehensive tinnitus treatment, it often does very, very well. So this is a powerful solution, not only for your hearing, but for your brain health as well. So I'd like to hear from you. What are your thoughts on this research? Leave a comment below. And if you'd like for us to review another research topic, comment below research topic. Dr. Suzanne, myself, and our team at Treble Health will provide it. Thank you guys so much, and we'll talk to you soon.